Greetings, peace, and blessings. We are the Mohammeds, the residential tourist, 85 to Africa. We are living in the after on this beautiful sunset day, moment, time, hour. it looks. I like how the sun is making you glow, baby. Or you making the sun glow. Anyway, so here we are. Yet again, it's always an honor, privilege to be able to come before you, share of our experience, share of our discoveries that would hopefully be of good information to you, just because, or if you're planning to come, to Kigali, Rwanda, or the continent for that matter, right? So the question is and still remains, is Rhonda good for your health? Is Rhonda good for your health, right? So some of you may have already seen from previous of when we took advantage of the uh, the nice hilly walking areas.
I don't think we've done it since.
I don't think so. I have. You hear the crickets? You hear that?
I've been hiking.
She was hiking up and down the steps inside. Anyway, so we want to just share some information, share some information that may be of help, hopefully, regarding your health. And, you know, take it for what it is. And, my wife, she's a lot more passionate about this, than I am. So she has a lot more information about it. But I'll chime in. I'll share my little bit.
Hmm. So it's a lot to cover when we're talking about health. And a lot of you guys email us or inbox us asking, how's the medical system there? How's the healthcare system there? We have a lot of seniors that want to come over. They have those questions.
They're here.
They're here. So there is a big concern with how do you navigate the healthcare. You can't use unless you have no you can't use any of your health insurances from the states. They're not going to cover you here. Um, but the good thing is you don't need it. You don't need it, and we'll get more into why a little later. But I've done some research just to basically find out what is the best hospitals. First, the best hospitals in the world, and the Mayo Clinic did a big study, and they list the top 150 hospitals in the world.
So here's the thing, real quick, before you go on to that. So just want to point out, because this is going to kind of help dispel some of the myths, okay? I won't even say myths, just some of the things that we're not expecting when you think about Africa, right? One of those things is it's like, okay, how is the healthcare system? How do they treat, one another as far as ailments, illnesses, and so forth and so on. So this is good to know that you don't have to worry. You really don't have to worry because they have some really good healthcare systems right here on the
Yeah,
continent.
but depending on what type of needs you have, can also help you choose where do you want to go on a continent, because some places are known for certain things and other places is known for other things. So on the Mayo study did a top study of hospitals, the best hospitals in the world, 150 of them. And unfortunately, not one hospital on the continent made the list. Not one. So if you're going to research and trying to find it that way, you're not going to see any hospitals
You
on the
might be a
list.
bit discouraged,
Yeah, you'll
but
be
don't be.
discouraged because you're like, huh.
Don't be.
But you have to also remember if you're coming to the continent as a healthy person, finding the best hospitals is not necessarily a requirement. because now you're going to be indulging in a healthier lifestyle, healthier foods, more active lifestyle. You have to be. There's no way around it. So your health should improve. If you're coming here sick, that's when you need to do thorough research. Um, Now, that was just for the hospitals across the world. When you look up what's the best hospitals on the continent, um, all the while I kept thinking it was South Africa because I kept seeing different hospitals pop up for South Africa. And they do have some of the best hospitals, and they do. Their hospitals probably could rank in that 150, but you know how they're going to just act like Africa doesn't exist. So, but the best hospital in Africa, period, is actually in Kenya.
Mm,
So happy to hear that.
me too.
Um, oh shoot, I have my little notes, but now let me see if I can find it. It's in Kenya, and they are actually known for being the top research hospital, not just in East Africa, but on the continent in general. Number one. The second best hospital system is in South Africa. This I already knew, and I had to research it before because I was getting some treatments done here, which was great, but I don't think it was. I think I've gone as far as I can go with what I'm hearing for right here in Rwanda.
Right here in Rwanda, right?
Yeah. So, in order to get to that, we have to do a little background. But even background for my mom.
Mm-hmm.
We talk about my mom when we were in the States. My mother was diagnosed with liver cancer. Now, I don't really talk about my spirituality too much on YouTube, but I have to say, I spiritually knew she didn't have liver cancer. And I just didn't feel it. I knew it. They kept saying they seen a little spot the size of a piece of rice on her liver. Prior to that, 10 years prior to that, my mom had hepatitis from a blood transfusion, which affects your liver automatically. And my family, we have spots, as you can see. We just are moly people. We have spots, we have moles. I don't know what it is. Just the mixture of the bloods. I'm just going to say that. It's the mixture of the bloods. A drop of Mazungo blood in my body.
A few drops.
A little tiny drop.
About 3-4
You probably got more drops than I do. And so my mom has freckles, moles. She has it all. Big birthmark. And I kept saying it's a spot on her liver. They won't do a biopsy because it's a liver, and they say if they poke it, then it could spread immediately. So they're just going to automatically treat it like cancer. And that just never sat well with me because you never could give me a true diagnosis that it was cancer. However, they decided, when I say they, my mom and my brother decided that the best thing for them to do was to go ahead and let them treat this. I supported it, but I wasn't feeling it. So they treated it with, what's it? I forgot what you call it. The needle to the liver and try to remove it.
That's what you call
Some kind of embolization. I can't remember what it's called. And then they wanted her to take 30 days of, not chemo, 30 days of radiation.
Okay.
A radiation pill.
See, I don't know. I mean, I know about it, but I don't know the names.
So after the 30 days, she goes, they say, oh, it's gone. We don't see anything. It worked. And I'm like, yeah, okay, whatever. It wasn't there in the first place. 3 weeks later, they're emailing her and saying, we want you to come in and get another treatment. And I'm like, asking them, why would she come in and get another treatment? Well, just in case it didn't work. You already looked at the scan and said it worked. Why? And mind you, when we looked at the bill, because, they send you the bill before or the same time they send it to the health insurance. The bill was already up there like $70,000, $80,000 at this point. And now you want to give an elderly woman another dose of radiation, and you didn't even check her again. And I this time was like, it's not happening. Forget about it. We're not doing it. And that was probably 2 months before we left for Africa.
Mm-hmm.
So when we came, and we're now letting them get their checkups done, and we took her to the hospital here, to their to their cancer center at King Faso, and they did the test, the scan, and they said, well, we see where they gave her the treatment, but we don't see any traces of cancer
Mm.
or where cancer was. They don't see that anywhere, and I knew it. I knew it the whole time.
Mm-hmm.
And for us, they like experimenting on us at home in the States. They like experimenting on us.
We know.
Not even just in the States, because anywhere.
We know about the Tuskegee and the whole polio.
Yeah, and they over here too.
Yeah,
they bring all
the
kinds
chicken,
of little
the
vaccinations
smallpox.
and treatments. And,
We know the history.
yeah. So for that doctor to say, they didn't see no trace of cancer, no scarring, no scar tissue from it, no abnormalities, no. And the whole time when we were in the States, they would do her blood work. They didn't show any signs of raised blood cells or white cells or anything like that. She had absolutely no symptoms. Only reason why they spotted it is because we were doing, she did experimental treatment on the hepatitis, which wiped it out. She doesn't have it anymore. That was one good thing.
Mm-hmm.
But in that process, the doctor was like, there is a little spot. And we've been watching this spot for years. We knew about this spot. It never grew. And the doctor actually fabricated the size of the dot so that it will qualify for the insurance to pay for the treatment that they wanted to get rid of. Yeah, exaggerated. So none of that felt right. By the grace of God, she made it through that madness. She's here. And that they don't even see a sign that she had cancer. So in that, it says a lot, because they're not using insurance here for us anyway. But the government here in Rwanda does make sure that every citizen has insurance. And Rwandese have insurance. And when I say they use it, they use it. They come, Jetta, my pinky hurt, I have to go to the hospital. I'll be like, boy, come here. I have one.
Girl,
It's always a boy.
No, it ain't.
Always.
No, it ain't. Don't. That's not true. You know that ain't true.
We've had a situation where one of our employees she was just distraught. I'm like, what's wrong, baby? What's wrong? Her mom in the hospital, and she'd been in the hospital for a minute. And so finally I said, well, why your mom in the hospital? What can we do with? She says, she got the menopause. I was like, what? She got the menopause. I said, what the hell? Y'all better get her some ginger juice or some ginger ale and ibuprofen and tell her to get home. She got the menopause. So you got okay. So it'd be that kind of crazy stuff. It'd be crazy, but anyway, they use their insurance. They do. So we're going to do the pros and cons of the medical system here in Rwanda, and because a lot of you guys want to come, and it's just going to be the raw truth. We've been to the eye doctor, so we'll talk about that. We've been to the dentist. We'll talk about that.
See specs.
We've been to we already talked about the little cancer center they have, which I like. That was great. And then, of course, just the medical system here in general and pricing. So for those that this is a concern for you, we're going to talk about it. So the pros and cons, we'll start with the eye doctor, eyeglasses. We call ourselves going to the bougie center, the one that's at the upscale mall here, because certain things you just got to be bougie with. When it comes to your eyes, we got to get the good stuff. So I myself was impressed with this eye facility.
Me too.
It was fast, thorough. We went to the doctor.
Professional.
It was young. No, he was from Kenya, right?
He might have been. But
I think it was the optometrist, whatever it was called.
Mm-hmm.
He was from Kenya, but everybody else was Rwandan, of course. No, he was from Ghana.
I don't know. I don't remember.
nonetheless, it was good. And when you go in, you kind of get seen right away, and you get the treatment. But what they had that was different, we wore after they take you through the eye exam and they take the test and they check your pupils and make sure you don't have any scratches and or any diseases. They could see if there's any diseases by looking into your eyes. Once they come with the prescription, before they put it in the glasses, they put these like binoculars on you. That's what it felt like, big heavy binoculars. And they put the prescription level in the binoculars and have you walk around. And I've never had that done in the States.
No, I've never had that.
So you can see if it made you dizzy, if the prescription was right, if it was too strong, if it hurt one eye and didn't hurt the other. Because like for me, I have almost 20/20 in one eye and the other eye I have way low. So my prescription don't never match. So they had to make sure that I wasn't going to get a headache from one. They did all of that. And then within 45 minutes, the glasses were done. Done. Not shipped out to the lab and you have to wait 2-3 weeks to get them back.
And you walking around half blind.
No, all of us, because we be doing family doctor's appointments. So all of us walked away except for, I think, just Lael and you.
Me.
Because they got crazy eyes.
Because my eyes is crazy. So you can't tell, right? But these are trifocals. These are trifocals. I said, Doc, don't make me look crazy, man.
Yeah, we thought his lens was gonna be like that.
Don't make me look crazy. Let me have some flavor, let me have some style here. They say, we got you. Don't worry about it. You ain't gonna have to worry about the thickness. You don't have to see that line.
Yeah,
see that line.
I was like, Lord, somebody tricked me. I didn't know he was this old.
So anyway.
Yeah, so and probably his eye exam, and he has special medicine in his glasses. The eye exam, everything totaled maybe 45.
Real so inexpensive.
Or 50, maybe
it
$50.
Was very inexpensive.
$50. Myself, I had gotten 2 pairs of glasses because even though my eyesight isn't as bad as his, I have light sensitivity. So I'm good all day. I don't wear glasses here because it's not very sunny. But at night, like I can't watch TV without glasses. So, and then I got the transitional lens. So if I'm outside and it's too bright, it'll bring it down some. And I have my regular glasses, the eye exam, everything. I think mine came up to 85. And that was 2 pairs of glasses, one with transitional lens. And I have one medication on one stronger than the other. And all of that came up to like $85. So the pricing is Nimbiza. And the technology that he used was great.
Yeah, it was really good.
It was a great experience. I was very happy to hear that.
Right.
And the whole family got their eyes done at that one time.
Mm-hmm.
The next appointment we went to as a family was the dentist.
We rolling deep, mob deep.
We make an appointment. It's for 6 people.
Wu-Tang going over there.
So we went to the dentist, and no one cried. There was no pain.
I almost cried.
Why?
No, I didn't. But it was, they had to work.
Oh yeah, we went for cleaning. So and the technology, it wasn't even that really freezing cold water on there. Was that what they used for your? Oh yeah, that makes me cry. I can't deal with that.
Yeah, I was kind of like, hold on, stop.
I couldn't do it.
Wait a minute.
Maleo, she had to get a lot of deep cleaning done on hers, but everybody else was able to pretty much just get their cleaning done.
X-ray.
Yeah, we got. Oh, the X-ray was talking.
Yeah,
they had a talking X-ray.
I never saw that before. You know what I mean?
It was talking in Japanese, but still, it was like, I was like, what's that?
Yeah, that was pretty cool.
Yeah, and then normally when you get your X-ray, you have to bite down on that big thing, and then they take the picture. Right. You didn't have to do that here. The thing literally just was like, yeah. I was like, wait a minute,
and it was crystal clear, man. You could really, really see it. Like, wow,
top notch.
Yeah.
And then, so recently or last week, I had to go back. So now, I have all kinds of issues with my mouth. And a lot of it stemmed from the medical condition that I had or have 6 months ago. So I had to go back a couple days ago and have a tooth removed. I have to get some more work done. But the tooth removed, when I say the doctor,
It's gonna be rough, y'all.
he was a Asian man. I don't even think he ever even touched my face. He had went in with such precision. I was very impressed. The needle, I've been in constant pain. My whole mouth has been in pain for about 3 weeks now. And he went in and he was able to remove the tooth, probably 3 seconds flat. He never touched my face. He didn't. I've had dentists, especially female dentists, literally climb up on the chair and they got to fight to get this thing out. I
That
got
was
bruising.
crazy.
My gums is all swollen for weeks.
I remember that. That was crazy.
It's crazy. Within 4 hours, I took the sutura. I mean the gauze out of my mouth. It wasn't a lot of bleeding. He did an excellent job. And just to have the teeth removed at home, because I didn't have insurance at home either. As an entrepreneur, insurance is not really a thing for us too much. And so at home, I had a tooth removed before coming. I paid about $400. Here, I paid $35.
35.
And I was acting like Big Willie. He was like, "Do you want me to do the other one?" I was like, how much would that be? Let's do it for Monday. I don't want to be in too much pain. $35. Thank God for that. And but he did a great job. That's the pros. The con is, even with the dentist, you go to the dentist, even if you had your tooth removed, you're leaving with instructions, right? How to take care of your mouth, how to rinse it out, how to, if this happens and you get lockjaw, blah, blah, blah. Nothing. I didn't get any information when I left. Fortunately, I'm a pro at this thing because I've been dealing with these issues for a while. So I know what to do and what not to do. But the average person, especially locals that go and have this done, they don't tell them anything. So you can do the wrong thing, especially when you have your tooth pulled, and it causes an infection. There's certain foods you're not supposed to eat that first 2 days. Ask me how I know, because it'll cause an infection and to get up in that, but they don't tell you anything. And I'm finding that a lot here in this the healthcare systems here. There's no follow up. There's no, okay, now that you've had this treatment done, do X, Y, and Z. Come back and see me on this day. There's no one that's going to call to confirm your appointment. There's no one that's going to make sure you do this right. Or there's nothing. There's no follow up. And that same that happens at the dentist as well. No follow up. Like, I have an appointment next week, but I don't remember if it's Monday or Tuesday.
Said what day it was for them to make the appointment. I totally forgot what it was.
So I'm hoping.
Call up there.
Yeah.
You gotta call them.
I gotta call them. If they don't call Monday to confirm, I don't know. But there's no follow up. So the other part of the medical system here is the medical system. It was very hard to get adjusted and used to how it works here. For one, if you have a cold or cough or whatever, in the States, you typically will call a doctor, make a doctor's appointment if it's at a point where you can't handle it. Here, the practice is, I gotta go to the doctor's immediately. I gotta go to the hospital. It's not the doctor. I gotta go to the hospital. My throat hurt. I gotta go to the hospital. So anyone that deals with us, they try not to tell me that they don't feel good.
Her. Yeah, that's her, because they know what.
Because I'm gonna cure you. I'm gonna heal you.
Go
real
out
quick.
back and grab one of them chickens.
No.
Take pluck a feather.
Come on now.
Feather out of it.
The first thing I
mix
do,
it with some apple cider.
You ask the girl. The first one I do is get the apple cider vinegar. So Francois, our cook, her stomach hurting yesterday. She said she's feeling like acid reflux, not acid reflux, gassy or something.
Right.
I said, "No, come on, Mama, I got you." And she already know that means. She's like, oh, no, 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 I already had some. No, you didn't. No, you did not. So we go
But
inside.
she did.
She didn't. She was just saying it because she didn't want
No,
me
she
to.
pulled it. I saw her pull it out.
She just so you will not tell me. Even I asked my mom. My mom said she didn't take
No,
it.
she got the water.
And Francois started smiling because she didn't take it.
Oh, okay. She
She
went through
started
the whole
smiling. They
motion.
do this to try to fake
She
me
got
out
the
so I
water
don't
the whole
bother them.
run.
So I actually poured it in the cup with a little water and had Imani. No, oh, I gave it to her, so she had to drink it. Within 10 minutes, she got it all out. Everything's coming out. So today when she came in, she was feeling bad again. This time she went and got it herself because she already know
That's what
the
I'm saying.
trick
I'm
of
talking
it.
about today. She went.
Oh yeah, today.
She
Today
went.
she went
Yeah.
and got it herself. She know the trick. She's like, oh, it worked yesterday. When she took it today, I had to go outside because she was about to make me gag. She goes, rah, rah, rah. I'm like, oh no, I don't do liquids, fluids. So I said, Francois, I wasn't even, because now I'm like, I know she got it out of her system. You okay? You just need to sit down, drink some water, and within a few minutes, she's gonna be good. Guess what she says? Jada, I'm going to the hospital. Why? Okay, mama, let's go.
She was like, look, she showed. I'm good. I got
Yeah, she
this
showed her
insurance.
little
I got
medical
my
card.
medical card. I'm
She's going
good.
to the hospital.
Let's put it to work.
I come home. I said, you be Francois okay? Yes, she's home. I said, what they say? Not your buzzer. Means no problem. I know that because I already cured her. She already got it all out of her system. But it doesn't matter. The other day, one of our team members at Ikawa, baby sick, crying. They rushed him to the hospital. He has a fever. And so he's nervous. I said, well, let me ask you. I said, how old is the baby? He said, about 15 months. I said, does he have a fever? Yes. Is his nose dripping? Yes. I said, that baby's teething. What? I said, his mouth. He's teething. Give him some ice. Take the baby home. He goes to the hospital. Comes back. I said, what they say? They say teething. Boy, I already know that. What did you do? They told him to give the baby like carrots so he could gum on it, or chicken bone. Like, okay,
Whatever
get that
works.
baby some ice, but they don't really do ice too much.
Ain't got no ice here.
Yeah, well, put some ice in that baby mouth. Get a cold washcloth, let him chew on it. He okay. All right, children Tylenol, keep it moving. No, they want to go to the hospital. Good Lord. But when I go to the hospital, I hate it. One, I want to go to the doctors. There's no doctors. You have to go to the hospital. There's no doctor's office. There's no urgent care. There's no whatever. You gotta go to the hospital. I don't like that. That's one thing. Secondly, you're not filling out a pamphlet of stuff, giving them information about you before they just start working on you. They don't ask you, are you allergic to anything? When the last time you've been to the doctors? Do you have any pre-existing conditions? They don't ask you any of those things. What's wrong with you? How can I help you today? You tell them, and that's what they're focused on. So I've had to get, my situation is so unknown. Nobody knows what's going on. You guys hit me up all the time trying to figure it out yourself. Why did she lose so much weight? I don't know. And guess what? They don't know. Nobody knows. I've been tested.
It's a mystery.
Tested, blood work, all kinds of stuff. But I had a situation where I was breathing real crazy. And we've had a nurse come find out I had a blood situation called thrombosis. I told you guys that before. And in this process of having that, I was having back spasms. I had a bone like go into my lung and puncture my lung with the back spasms. And the reason behind the spasms was the thrombosis. But with that, they wanted to do a C scan on me to see if I had any blood clots in my body because the blood work was showing high levels, and I should have had blood clots, is what they're thinking. So they kept trying to get me to have a C scan, and I'm like, okay, I can have a C scan, but what kind of contrast do you use? What? What kind of contrast do you use? They're not used to they're not used to people asking them questions, challenging their diagnosis, having a conversation about the medical care, or not even just a conversation, but having an opinion about the medical care. I want to know what is my levels, what is my blood pressure, what does it say? Oh no, because that's look in the States you have to do that. You have to know everything that's going on in your medical care, or it just might get got. Who knows? We've had situations where that happened. So here I'm like, okay, I'll do it, but what's in your contrast? And so they didn't even know what's in the contrast. They had to call the specialist or the anesthesiologist to find out. Y'all got to see how big this mosquito is sitting on the phone
Yeah.
trying to torment me
She gonna want it.
because he
She gonna be the
smells my
one. She
thrombosis.
gonna get it. She'll be knotted up. Let it go.
Look at him. He's trying to go inside so he can get me. So they didn't even know what's inside of their own contrast. And did they ask me before they decide that I need to go in this room and go ahead and just let them give me an IV and put contrast in there? They would, if they asked, "Are you allergic to anything?" I could have said, "Yeah, I'm allergic to shellfish." That's what's in the contrast. No, you're not about to put that in my bloodline. I know what happens when I get near shellfish, and it's typically with the contrast. I think it's grounded up shrimp. I'll close up, and they don't ask any questions about your allergies or anything because they don't normally people don't normally have a clue about what's going on. Okay, push ball. So if they had asked about
We had to
the
come inside, y'all, because the mosquitoes was getting with us.
yeah the mosquitoes, first we just thought it was my unique blood type, which is O negative, and then to find out I have thrombosis, which is the thickening of the blood. They just I'm a smorgasbord for them. And then when they bite me, I'm super swollen in every area that they bite me on. Small little dot the first day, the next day I'm lumped up, looking like Cyclops. It's horrible. But if they had asked then about the contrast, if I didn't know that I was allergic to anything, I probably would have been on that table probably, and I don't know if they would have been able to pull me out of it. I don't know. So knowing knowing your own medical history, going anywhere on the continent to any doctors, because it's not the culture to ask. For some reason, they don't ask you any questions. Just what's going on with you today. And so, also, I've had experiences. Let's say today, one of our team members went to the doctor. She had the fever, and she was coughing a lot. So automatically she's thinking I have malaria. Malaria is a thing with these mosquitoes. Malaria is a thing, but it's easy. You just take a pill 3 days, you keep on going. But it will knock you out. Ask Mr. Malaria guy right here. It'll lay you out for 3 days.
Said, oh boy.
Yeah, I mean, just sleeping. You got the chills. You're shivering.
I'm talking teeth chattering.
Yeah.
It's not like I'm cold, though, like convulsions almost. It's
Yeah,
like, yo, what's going on with my body?
And I'm over
Doing
here
a Harlem
hot,
Shake.
so it's like, oh my God, I'm putting robes and blankets on top of him, and I'm just moving over. But so she goes to get tested for that, for the fever, but why they give her a test for her bladder? I said, what they do that for? I don't know. I said, well, do you have pain in that area? No. Do your back hurt? No. Or you've seen blood when you urine? No. Well, what would they give you a test for that for? It has nothing to do with why you went to the hospital. I don't know. And then when she comes back, I'm like, so what was your temperature? I don't know. They didn't tell me. Well, why didn't you ask? I don't know. The results didn't come back yet. The results is for the malaria. It's not for your blood pressure or for your temperature. It's not, I don't know. They just trust the system, the doctors, and they don't even ask what's wrong. They don't ask what's wrong at all.
But here's a way to look at that. Because we we have to. When I say we, coming from the states, knowing the history, circumstances, so we have to really, we got to investigate. We got to just make sure,
We
okay?
do.
But they're in a cultural society where they don't have those concerns. They don't have those.
But that's very dangerous.
It is
It's
that.
very
I'm just
dangerous.
saying that they don't. That's just something that they don't, which is a beautiful thing. They don't have to concern themselves with those concerns, and so it's not really programmed in them to be able to say, "Hey, let me make sure he just trying to experiment on me or whatever the case may be, just to get some extra dollar, whatever." So
Yeah.
they don't have to really concern themselves. So it doesn't. It's not programmed in them to be able to
I don't
acquire.
know. Because wait, last year we had a gentleman, one of our team members, had his nose was infected and he couldn't breathe. So he wanted to go to the doctors. I already told him it was allergies. I already had the medicine for him, but he still went to the doctors. He come back, they tell him it's allergies. I already told him that. But why did they prescribe for him female ovarian medicine? And he ready, I said, take a picture and send it to me because we were talking on the WhatsApp. So he took a picture, sent it to me. I Google it, and I'm like, I said to him, I said, dude, you got ovaries? He said, no. I said, well, why didn't you read what this medicine is that they done gave you? What is it, Jada? I sent him a screenshot. He calls me, he's like, what? I say, yeah, I think you're a girl. I said, no, I'm not. So also you have to understand the emergence care here. They call it emergence or emergency care here. It's not the same as the emergency care at home where you dial 911 and the ambulance come out within 6 minutes or the police come out in 6 minutes. It doesn't happen here. It just doesn't happen.
What happened?
We had an event at Ikawa and a gentleman he just arrived from getting off the plane. Head went back and he just passed out, collapsed, fainted right there on the ground. And we cannot get him up. We cannot get him up. And it was scary. He was an older gentleman. So right across the street from us is an emergency
It's a clinic.
clinic.
It's a clinic.
And, my husband and one of the managers ran over there and asked them to come, maybe bring a stretcher out or come check the man's vitals. And they were like,
Bring him over.
yeah, they're going to tell us to
I
bring
said,
him
listen,
over.
this man has passed out. If we could have brought him over, we would have brought him over. We cannot bring him over. So
And so they were like, well, it's only one of us here. We can't leave.
and it wasn't just one of them.
Yeah.
So I had to say my piece and then left because it was other patients that was like, oh Lord.
But the fact that we're telling you an older man is on the street, passed out. So needless to say, and it's been about 5 months. No, it wasn't 5, maybe 4 months ago.
No, it wasn't that long ago. About maybe 2 months.
She came in October.
Yeah.
It was in October, but we're still waiting for the ambulance to come.
Yeah, I'm waiting on that joker to.
Yeah, he's gonna come. He's gonna come, and we'll tell him he's okay now. He's back in the States, but we're still waiting. Yeah, so it's a little different here.
Yeah, it's a little different. And, even speaking of the ambulance, if I just say maybe real quick, even today. So, so when we see an ambulance, right? We like pull over, we let them go do their thing or whatever. They don't, I don't know if they have them, but if they do, they don't use the actual sound. The lights will flash, flicker. But the sound you won't necessarily hear. So I see, as going through the roundabout, I see an ambulance. So I'm like slowing down. I'm stopping.
He's trying to pull over. They're about to beep him. Beep. What the heck?
But he wouldn't move. He wasn't going. I'm thinking this is an emergency,
Yeah.
and I'm really trying to just
Nobody
yield.
moves out
So
their
no
way.
one
It's
moves
like
out. No, they don't. They don't really do that. So
even the popo when they're driving down the street and they got the lights on, nobody moves over. I'm like, dude, move
I mean,
over. What's
we like,
going on?
yo, you get out the way. You better get out the
They ain't
way.
moving. So there's no emergency care like you dialing that. You think you just know the ambulance coming? Mm-mm. No, and it don't matter if you expat, whatever, local, Mozongo, it don't matter. You're lucky
Right.
if they come. So it's you really have to know your medical needs.
It would be best
Yeah,
to.
bring your medical file with you, especially if you're moving. We put our moms had theirs scanned on a drive, and we have the hard copy.
Right.
It almost seemed like it's not necessary because they didn't read it, and we're giving it to the doctors and the specialists.
But for you to know.
But for you to know,
Right.
right? So even like so stuff that you don't do, you don't need, you don't already had it done. You need to have those type of forms available so that you can reflect because it's not in their system. I don't know if they even keep a record of because what we've done because I hate going to the hospitals. Even at home, I hate it. But the fact that I have to go to the hospital to get blood work done, mm-mm. So we have created a system with one of the traveling nurses to come and do that for us. A lot of the expats use him now, where he'll come and get this blood work drawn. He'll take it in, get the results, keep a record, a history of it, and then even schedule your appointments with specialists,
Right.
which is important because, as we said, there's no personal space here. So you'll be sitting out in the hallway waiting to see a doctor, and someone will come in, the door will open, and they will run. Whoever gets there first is the next person's turn.
Yeah.
And it don't matter that they just came in or not. And it's crazy because my nickname for us is the Crazy Americans because you're not doing that to me. Oh my God, that's not a good thing. It's not a good thing. So our nurse, he does it. He
has it. It's a good service and
right to the door. I'm
it's
like,
a
okay,
benefit.
thank you.
And it's really because it's needed and it's necessary.
You
But
have to.
these are just some things that
That's different.
It's different, and it will be to your best interest, just to know. I mean, you get excited, you want to travel, you want to relocate, and you see the infrastructure, and you see that it is a livable place. But these are the nuances. These are the little things that you want to, just want to make sure are at your disposal. They're in place, or if they're not, that you have what you need to have in place, so that life-threatening situations or anything, then you'll be okay. Hopefully, you'll be okay. And so yeah.
Yeah. But when you go in there, now I've seen a cardiologist. I know her name.
And they know ours.
Because I like her.
Right.
They're very thorough.
They're very thorough.
Very thorough.
And that's a good point. So here's the thing that I like is that even though they are maybe not as efficient or to certain standards, you really get a good sincere care. They care.
Mm-hmm.
They really, really do care. And you feel it, and it's sincere. And so I love that. I really love that.
Yeah. When I first went into the hospital, I guess I could barely walk without having to breathe. Couldn't breathe because my lungs were still sore from the puncture. And the cardiologist seen me, but I wasn't there to see her that day. But she seen how I walked in. And then ran into her at the mall maybe a few weeks later, maybe a month later. She remembered me. She said, "Oh my God, you totally different." And, and I'm like, nah, I don't be remembering people. So I'm like,
Never.
she said, "I'm Dr. Gloria." I'm like, oh man, I like And we brought cookies to them just because I wanted them to they don't come back. But remember Ikawa Cafe, but also because of how they treated me. And I've never had that experience before. The cardiologist and the GP was the first one. That's Dr. Gloria.
Mm-hmm.
And then the cardiologist, and then we've even met, we came back. So they give you every test imaginable, trying to figure out what's going on with you. And that sounds scary because we're paying out of pocket. But when I promise you, didn't come up more than a couple $100 for CAT scans, MRIs. Um, I had a Doppler done, a heart ultrasound, amazing technology. I've had a whole bunch of stuff done, a whole bunch of blood work done. Probably didn't come up to $40. So the cost, and you know, how often do you go to the doctors? For me, having insurance isn't necessary, especially when the pricing is so inexpensive. It's like okay, um, and the treatment was very good. It was good. It's just for me. I think I need to go get some extra opinions, or I need a little bit more deeper digging. And so I plan to hopefully go to Kenya or South Africa to get some additional testing done once finances allow. On top of that, the general health here, the foods are better, of course. And then, of course, you have probably less stress, I'm told. We're business owners, so that doesn't apply to us.
Yeah,
I've never
our
had this
stress
much
is
stress.
business related, but just not on the day to day
Right,
and driving.
right.
We ain't gonna go into that. We talked about that already.
But
Outside of that, you don't really have that
you
stress
don't have
issue.
that stress, but you have to know your body.
Right.
And if there was anything that I could have researched more on before coming, knowing the type of body and blood type that I am, I would have would have researched the sun. Because I have that type of blood and that type of body where I have to have a certain amount of sun every day. Or we've learned a few years back that at certain times, I am extremely vitamin D deficient. So, and the biggest cure besides them giving me vitamin D pills was sun. I needed more sun. And besides the health conditions that it causes and mood swings, it causes you to be severely depressed. And then we go and research and move to a country where even though the sun is out, it's still cloudy. It's rainy, it's cold. I don't have direct sunlight all the time. It's like for me, I feel like I have to run out when I see it and try to get it because it could be gone. And maybe 2 to 3 hours a day, it might be hot. I don't know. It's not often. So it keeps me, and then they have 2 rainy seasons here. And those seasons aren't just real quick. One could be 2 to 3 months, the other one 3 to 4 months. So I am dealing with a lot of darkness and shadowing, and I'm not getting a lot of sun. And so my body hurts a lot. My bones might be hurting a lot. And I'm fighting depression because I don't get that sunlight. And I daydream about sun. I daydream about the beach. I daydream about just getting direct heat because I'm not getting it. I'm sorry if you see one of these
Little ones.
going to try to crawl down.
But but you know, it's just, again, being able to just have all the knowledge that you need to have, you know, about your own health, medical condition, it will be very helpful. Um, and you know, you just do what you would normally do if you were in the States. If you have to go to the hospital, which is what, you know, we do when we go, we just ask questions, get clarity, tell them no, this is not, my body can't do this or that, you know. And I like to think that hopefully, you know, we won't have to go. You don't have to go to the hospital, but hopefully, if enough of us do have that hospital experience, and they're getting accustomed to, okay, these individuals are coming and they are, you know, probing so that and making us have to really know what to do, how to handle these, and may add that into their regular routine of treating their customers. So
Yeah,
it's teachable moments as well.
it's really they're just missing the triage.
Yeah, yeah,
You know that beginning part of going to a doctor or going to a hospital, and you sit there and you answer these questions, and they do your vitals and your weight and all that kind of stuff, and create that chart for you. That they're missing that part.
yeah. That's
So
yeah.
you need, if you're coming, you need to come with your chart. You need to come have a knowledge about what your body needs and what it's been through, and it's a direct dialogue with the doctors at this point. You know, in anywhere you don't allow someone to just make choices for your body without your input. You know, okay, you're the doctor, you're the specialist, but I'm the one. I know what I'm feeling. I know what's going on, and most importantly, you have to research any medicine that they're giving you because they don't. And since they don't ask you your allergies, if you have, I'm allergic to aspirin, so they give petaminazole or paracetamol,
Paracetamol. Yeah.
something like that. Most of them is ibuprofen based, which is great. But in the beginning, I have gotten some that had aspirin in it. Most medications that they have here comes from Germany or Belgium, which is fine. That's great. But you literally have to go and Google it because it's going to be in that language. So no, you don't even know what's in the stuff. You have to Google it to find out what is in here before I go and take it on. But the cost of medication, it's wonderful.
Man,
It's wonderful. It is. You don't have to worry about copays.
it's
So
none.
we have a friend here that has a pharmacy, and basically every month the mamas give me their list of their meds that they need, and has it delivered right to them. And usually, and my mom gets about 4 or 5 different things, blood pressure and blah blah blah. Usually comes up to maybe $50, and you know their medicines are normally expensive. Um, Ibuprofen you can get for like 60 cents for a pack. Just very inexpensive. Everything, all their medicine, the medication. I haven't heard of anything that costs more than $30. And one is like a cancer stabilizer that one of them takes, and it's $30. And it's like, okay, at home with the insurance and the copays, it still was coming out to be like 200 that they were paying. So the cost of medicine is very inexpensive. If there's sometimes you have medicine that you have only in the States and it's not here, and what the pharmacists do, she'll go and she'll research, or she'll call, she's from Atlanta, so she'll call the pharmacy in Atlanta and find out a comparable one that she can get here, and then y'all talk it out, and if you want to switch to that brand, we could switch, and it's the same dosage of everything else, so it's perfect. So there hasn't been anything in particular that either one of our mamas needed that we weren't able to get. The sleep machine, we had to make some adjustments with the nozzle that they have here versus the kind from the States. But outside of that, we haven't had a problem. So with that, we wanted you to have a thorough view of what we've been going through here in Rwanda with the medical system, the research we've done about Africa's medical system in general, and do know that you can get what you need. You just really need to be on top of your game while you're doing it. That's my take from it.
That's it. That's good. That's beautiful. So thank you so much. I'm hoping that again, this is some good information for you that you can take into consideration, and we'll continue to try to bring you whatever information that we may acquire from our experience, or just acquiring just knowledge base, and share it with you. So please do subscribe if you have not.
Please subscribe. I don't understand.
Like,
We're fighting for 4,000 viewers. Please.
please like, and also share. Your sharing might inspire someone to subscribe.
Yes.
So, but thank you though. Thank you for tuning in to us. And
1 second. We've gotten 2 people from our last video that sent cash apps. I just want to thank you guys personally. You don't understand how much we appreciate it.
very much.
Every time I wake up and I see it, I'm so excited and happy. I'm like, wow, they like what we're doing. They're going to support us.
Right.
So thank you. If you want to donate to any of our causes, Cash App.
One cause.
We have the residential tourists. We also have Ikawa Cafe.
It's all one
So,
cause.
Whatever. You can specify Ikawa Cafe, which some of them do, and other ones specify because we love you. So, Cash App, money sign, residential tourists, and we take Zelle as well. He'll have it in the
I'll make sure you have all the information. So yes, thank you for your support, whether it's monetary or moral.
Sharing,
subscribing, truly and sincerely. The feedback,
definitely the comments.
The comments.
We create videos off of the
right.
comments.
And for those who just keep it real with us and be like, look, you know what? Come on, man, pick up the pace.
Give us some more.
Give us some more. Pick up the pace. Whatever it is, we receive it because we're receiving it in the spirit that is being given. It's all love. So, thank you so very much, and peace and blessings.